Okay, so I have got a really interesting chat actually coming up with you today with Professor Dawn Sim, who is, and I've had to check the pronunciation of this, an ophthalmologist, which basically means she is an expert in vision and eyes and eye health. She's a consultant at Moorfields Eye Hospital, and she is one of the founders of Mthk, which I'm sure we will go into a little bit later when she joins. So it's interesting because I think we talk about all these symptoms to do with perimenopause and menopause, but quite often our eyes don't really get a look in. But judging from the deluge of questions that I've had from you guys, it very much is a topic that is really affecting a lot of you. So we've got a lot of questions to get through. Probably way too many to actually cover in 30 minutes, but we are just waiting for Professor Sim to join us. I was bang on time, so it might be that it's going to take her a little while. But essentially, it would be great to hear from you guys what kind of eye issues you are experiencing. Here comes. Drop them in the comments below and we'll see if we can cover them as we go through. So, here she is. Here she is.
Hello, can you hear me?
I can hear you loud and clear. How are you doing?
Very well, very well.
So I was just saying, I don't think I put a Q&A box out to my followers, and I don't think I've ever had so many questions about eyes. So, we are really, really happy to see you, and I've got lots of questions to get through. We probably won't get through them all, but I'm just going to dive in, I think. So the majority of the questions were from people complaining of dry eyes. That was the number one symptom that these perimenopausal and menopausal women were talking about, but also gritty eyes, so watery, crusty, sometimes itchy eyes, particularly in the morning. Now, can you tell us why this is so prevalent during perimenopause and menopause, and then what we can do about it?
Oh yeah, definitely. I think there's a lot of overlap in what I will say, so we'll get through it in 30 minutes. There's a time of change in hormonal levels, and I think the key players here are estrogen and testosterone, or androgens, because there's more than one androgen. And in that change in balance, what we don't realize is the glands in our eyes. So we have lots of different glands, but predominantly three types: one that produces liquid, one that produces oil, and one that produces mucus. And all three are terribly important because our tear film is made up of three layers, not just water, but you've got oil on top to prevent evaporation, and you have mucus underneath that acts as an anchor. And these glands that produce all three substances have receptors for sex hormones, as we call it. So as the estrogen level declines, it's up and down, and as testosterone goes down, they produce less. And that's the crux of it. And men do have these symptoms as well. So we see it in men who have loss of testosterone for whatever reason. And that's what happens. It's not just it doesn't produce enough, but the consistency of what is produced has changed as well. So I find it terribly interesting that our tears become more salty in different, particularly in perimenopause. You might hear the word hyperosmolarity come up. So it's like, in science it's called too salty. And the oil glands that might overproduce, and that's bad as well. Your mucus layer might change in consistency. So the whole thing is just very angry at that perimenopause.
Yeah.
So I like to think of it as my teenage daughter who's going through puberty. I'm going through puberty, Mama. And for anything, I don't want to do my homework, I'm going through puberty. But it's a mad time.
Yeah, and it's puberty in reverse, right? That's not
I think think the imbalances are very similar, to be honest. I was telling to my colleagues from MTHK that we got together and we became very good friends. It took us a year to find formulations for the stuff that we produce, but it's we're more emotionally mature though. I think in this at the time of change to be able to handle it. So hence this discussion.
Yeah, no, there's definitely positives to be had. Now, interesting, I just wanted to pick up on the saltiness. Is that simply because our tears aren't as diluted?
There's several reasons. So we have a gland up here called the lacrimal gland, and that's the predominant one. It's when you cry, that's where most of the tears come. But the basal production of tears does come from the lacrimal gland as well as the glands that are in the whites of our eyes. They produce a little bit of water. And we don't really know. I think that's the answer. Why the changes in hormonal levels changes the salt content of our tears. We know that tears are produced with different kind of transport mechanisms, and water moves when salt moves. And so it's just that differences. I think the exact pathway we're not really clear on.
And why does it feel that most women particularly find these symptoms prevalent in the morning? Is it simply because our eyes haven't been, blinking and kind of washing themselves almost?
Your eyes do dry out at night, particularly if, 20% of us, it's called the Bell's reflex. I'm going to do something really gross on people like that. When you close your eyes, you roll upwards. Can you see that?
Yeah.
Yeah. That's called the Bell's reflex. So that upward roll protects the eye, but 20% of us don't have that. You can check that in the mirror, but you have to film yourself. And if your eyes are doing it slightly at night, that bit starts to dry out and you feel gritty, sore, and stingy in the morning. When you sleep and the eyes are shut, a very amazing thing happens because, when your eyes are open, oxygen gets to it very easily. But when your eyes are shut, the metabolism changes entirely because oxygen doesn't flow in. So at night, as that is happening, plus the eyes can feel quite dry, especially if you don't moisturize before you go to sleep. It's like skin. You have night moisturizer and day moisturizer. So similarly with the eyes.
So what would be good to moisturise? What kind of products are we talking about for women who are experiencing these dry eyes?
I think having a preemptive approach is very important. So by the time you feel something, it's a vicious cycle of dry eye, a cascade that I can go into, but normally you get bored by me. But if you moisturize your eyes at night, you need to use a thicker eye drop. So something that contains sodium hyaluronic acid, as we call it. Yeah. And that's a no-brainer. But I put moisturizer on my skin. I do look at the contents, and it's a different one I use at night. That's the one I use in the day. Indeed, a thicker eye drop. The problem with thicker eye drops is it blurs your vision, so it's not so good to use in the day. And as simple as that, just before you go to bed, before you flick off the light, if you read in bed, just before you flick off the light, put some eye drops in, a couple of blinks,
you're good to go. And so I know that you, with MTHK, have produced your own range of eye drops and eye sprays. So I'm assuming, therefore, that the hyaluronic acid is in these drops, right?
Yeah, they are. And particularly in the drops, I think that's important. The other thing that's in there, besides just water, it's no point putting water in your eye. It lasts like 2 seconds and it evaporates. We have liposomes in it as well. Liposomes are really important. They're used in a lot of cosmetic eye creams as well. So I would say, as you spray, some of it goes around the eye, which is great. But liposomes are a type of good lipid, good fat that prevents evaporation of the drop as well. And that's good for the daytime.
Okay.
Screen work, etc., etc. Or if you go on a plane, I was on a plane recently for 14 hours. The kind of artificial air that circulates very dry.
And I think lots of us are noticing that we are, particularly having eye issues because of kind of post-lockdown. We're zooming more. I mean, I'm staring into this ring light right now. We're using screens so much more. So I think that kind of has had a knock-on effect as well, right?
Yeah, definitely. And I think particularly in that perimenopause phase where the skin gets drier, your oil production changes. You talk about gritty eyes. So gritty eyes is not just dry eyes, it's a symptom of irritation. But we have about, 100 plus, 50 plus on top and 100 plus at the bottom of oil glands just at the lid margin. And if these glands get blocked up, the oils harden, and we call it concretions, which is little bits of fat within the eyelid that scratch on the eye. Because the lids act as like a windscreen wiper. So it needs to be nice and clean and smooth. And if there are bits on it, it starts to not only scratch the eye as you blink, but also it doesn't spread the tears evenly in your eyes. So there's a combination of these factors.
And then people, we start rubbing our eyes, and then it kind of exacerbates it, doesn't it?
Yes, it's an inflammatory cascade. So you have that irritation, and you have inflammation, and inflammation can cause tissue destruction, so a change in the architecture of the lids and the skin around the eyes, and then that precipitates the cycle over and over again.
Now, once somebody actually asked a very good question, in terms of eye drops, can you overuse them?
No.
And should you use it preventatively or just when you're feeling this dryness? What's the best kind of protocol?
I think the best thing to do is just to have a good habit of moisturizing, like you do, and we all have our own thing. I tend to go after a shower, and I go, okay, let's give my skin a good old moisture bath and then air dry. But with the eyes, it's good to do it in the morning and the evening, and then put something by your computer. Just have a good habit to use it regularly. Especially, I think, if you have symptoms. I think if you don't want the symptoms. So I have terrible dry eyes. I mean, all the drops that we produce are preservative-free, so that's really important. A lot of drops are not preservative-free, so read the label. And if it is preservative-free, you can use it as much as you want. If it's not, those preservatives actually irritate the eye. Quite badly, some of them.
I like the spray because I can keep it next to my laptop, and I'm assuming that this is okay, that you can actually spray it when you're wearing eye makeup.
Yes.
Yeah.
So if you're wearing don't overdo it if you're wearing eye makeup. But
they'll be like So one spray each eye, and they are incredibly refreshing actually.
And with the eyes closed.
Yeah.
So when your eyes are closed, when you blink, after you spray, just blink a few times. There's a wicking action, and the water gets drawn into the eyes. I wouldn't worry. And even with eye drops, people worry about, I can't put eye drops with my eyes open. But what I would do is just tilt your head back, close your eyes, put it in the corner there, and blink. And that's what we do with kids.
Yes, that's why my kids. And the spray is really good for anybody who is a tiny bit, reluctant to put things into their eyes, because I know lots of people are quite squeamish, right?
Yeah, it doesn't blur the vision, so.
Now, somebody's just asked on here, does dry eye or, perimenopause kind of type symptoms, can it cause pain in eyes? And, if you are experiencing pain, is that something that should be checked out, do you think?
So different types of pain. I think burning pain, a burning sensation tends to go with dry eye. If there is occasional burning pain, that's because the skin of the eye. So we have more nerves. It's the second most innervated organ in the body, the front of the eye. I won't tell you what the first is. I think it's out of topic.
I can guess.
You can guess, yeah. But the corneal surface, the clear skin of the eye, has the most nerves in the body. So if it's a little bit roughed up, you do get that burning sensation. But if it's persistent, you should go see your optometrist to start off with, because they can do a rudimentary eye exam. Ache is not dry eye. Sharp pains can be with dry eye, especially when you blink. But if it's a sharp pain when you're not doing anything, that's not dry eye either.
Okay. And quite a few people actually ask, would HRT, so hormone replacement therapy, does it help with eye? I mean, we're not going to prescribe it, or doctors aren't going to prescribe it for eye conditions, but, as a kind of side effect, a positive side effect, does it have a positive impact on eye health?
Not directly, so there's no evidence for that. And there's evidence that says it does, there's evidence that says it doesn't. The whole putting progesterone in there, does that do anything? No one knows as well. So I would say take HRT for other reasons. And mood really impacts on eye symptoms as well. Well-being, general well-being, health, what you eat. It really impacts on how you feel, your general wellness, but also on your eye symptoms. And I think everyone can agree with that.
Yeah, no, absolutely. Do you think that there is any kind of evidence for people who are experiencing eye strain? Is there any evidence to suggest that things like blue light blocking glasses can help?
I'm not a big blue light blocking glasses fan. I know it works for a lot of people, and they feel great with it. There is no hard scientific evidence to say it protects the back of your eye if you're looking at blue light from screens. But I do know it gives me eye strain, and it does dry my eyes out because I'm not blinking enough.
Right.
I think if you go into bright sunlight, so I just moved to California, I have to wear UV protection. Because I've looked at my skin recently, I thought, gosh, I'm looking like a handbag. Although I do look like I had an old leather satchel when it was fashionable to have one.
Professor Sim, come on.
And can you imagine what that is doing to the surface of your eye as well as the back of your eye? So UV protection, there is no question about that. Blue light, less evidence.
Yeah. Well, it's interesting because on your website you say that we spend thousands of pounds a year on skin and hair, but we don't give a second thought to our eyes, right? And they really do deserve better. So I think, there are, like you say, some small investments that you can make in order to really kind of help their longevity as well as their kind of, immediate health. So somebody on here is saying that they've got symptoms of eyes being sensitive to brightness. Is that a normal reaction to sort of during midlife or perimenopause, menopause?
Yeah, so the corneal surface, remember the one I talked about having lots of nerves? Before I talk about that, you know how we have this mirror, the mirror of the ring light and the magnifier to scare us at the morning? They go, oh, God, what is that? We use an upright microscope called a slit lamp, so I can look in great magnification on all the layers of the eye with that microscope. And if you look at your skin on that magnifier, it's terrifying. But if you look at your eyes with that microscope, sometimes, the eye makeup I see floating in there.
Oh, really?
The little dots on the skin of the eye. It's if you don't moisturize the skin, it becomes dry. But taking care is very important. So we talked a lot about the drops and things. When you have those dots and roughness on the surface, as light enters your eye, it doesn't go straight through as it should a lens and bends and hits the back of the eye. It becomes scattered. So if there's irregularities, light scatters. And that scatter we feel as glare or brightness. And that's why you have that sensation. And it's real, Gosh, the light flooding my eye. But other than the little things you can do to moisturize, I think a good diet, really good vitamins for eye health is really important. So, eating oily fish once a week, dark green vegetables, not too many carrots. It turns your skin orange if you eat too many carrots.
Yeah. I used to be an avid juicer. I'm not anymore, but I used to drink pints and pints of carrot juice, and it turned my eyeballs went yellow. My skin had a kind of yellowy tinge. So
yes, yeah. But it's nice with apple, green apple, actually, green apple and carrot juice. I was just thinking about juicing because there's only that many carrots you can eat. Right? But we do make a supplement as well. And what's really cool about the supplement is we have all the vitamins that are important for eye health, particularly inside the eye. So inside your eye is like the film of a camera. Nobody understands this analogy anymore. But we have the lens in front, on the surface of the eye, and then you have the film where light focuses. And those cells are really important because you're born, like the ovaries, you're born with a finite number. When those cells die, they don't get replaced. So you want to keep them as healthy as possible.
Yeah, No, absolutely. And I think you're right. There are lots of things that we can do through diet. So, adding in omega-3 fatty acids are really important. So particularly, a really good kind of source of those is oily fish. So it's that DHA component of the omega-3s that we're really looking to support the rods and the cones and also vision. And actually, I read that, and this is kind of personal because macular degeneration of the retina runs in my family. And I read that there, in certain studies, that there could be a link between maybe reducing the kind of not the onset, but reducing the kind of the speed at which it develops. Is that true?
Yes. So if it runs in your family and if that's particularly relevant to you, the things you must never do is smoke, because that's number one thing that accelerates it. I'm not passing judgment on anything, but it's more that's the evidence of that is huge.
Yeah.
And the UV protection, because those are things that you can do and can change. The UV protection is important. Inside your eye, you have almost your own sunglasses. You talk about omega-3, but it's actually lutein and zeaxanthin. It's carotenoids, like your carrot juice, but better. It's more yellow. Think of it as a yellow carrot, I suppose. And these are pigments that are found within the retina, above those cells that don't replicate. So it almost acts like a internal sunglasses. And it's very hard to have them in the natural diet. I can't remember that.
Well, it's things like egg yolks.
Yes, that's right. I do love egg yolk. Again, how much egg yolk can we eat? I suppose if you have holidays. But yeah, lutein and zeaxanthin are the key pigment things. And prevention, again, better than cure. So age-related macular degeneration tends to come on after 50. And having good diets in your life would be important for that.
Yeah. Do you think we need more frequent eye tests during perimenopause, like from our kind of mid-30s, 40s onwards?
I think past 40 once a year at the optometrist is really important. They'll pick up anything big. There are a lot of things that are asymptomatic, so you don't feel it until it's too late. But conditions like glaucoma, if you have dry eye, the optometrist can give you some advice as well. If it's on the severe spectrum, yes, you do need to see an ophthalmologist. So I think that kind of eye health, what we don't tend to do in the UK is the general wellness check, even with the GP. They really don't have space for that. But actually, you need to check your blood pressure, understand what your cholesterol is. I do that myself because I want to know. Diabetes runs in my family, so that's important as well.
Yeah.
Something to add, lutein and zeaxanthin, is we have something in the supplement for dry eye as well. And we look long and hard for that because the evidence base for oral supplementation and besides HRT, dry eyes is very tenuous. But we found a berry called Mthk berry from Chile that actually has good evidence that it can increase tear production. So I think in that perimenopause stage, it would be useful as well.
Yeah. No, there's a really good study called the Age-Related Eye Disease Study. I've had to write it down because I knew I'd forget it, from 2013, which talks about, the lutein, the zeaxanthin, the vitamin C, the zinc, the antioxidants. And all of these are included in your vitamins, right?
That is based on, we call it ARADS. We love our acronyms, right? ARADS formulation, and anything that doesn't have an ARADS formulation is not evidence-based. Yeah. That was a very large, hundreds of million global study that looked at tons of people taking supplements and placebo, and that showed a delay in progression of disease. I love that study. I remember being in the audience when it was announced, and this lovely woman called Emily Chu, a slightly older lady. She's like the queen in ophthalmology, gave the results. And she said they found no link with omega-3 and progression of disease for age-related macular degeneration, funnily enough. But what they did find was that if you ate oily fish once a week, it did have a significant effect. And she said, we don't know what it is in that fish.
Oh, so it's interesting because actually in that same studies we like evidence on my channel. There's significant evidence, right? So I think what it said was that eye-related decline was reduced by 25%. So that's considerable, yeah.
It's huge because it's really loss of central vision we're talking about. I meet a lot of people in the 60s, 70s, 80s where they're blind in one eye from the same condition, and they are worried to death about the second eye. There's no treatment besides supplementation at the moment for the prevention of progression. They're looking very deep into giving other more complex medication, but that carries a lot higher risk. So that 25% is really huge, particularly if you have it in your family.
Yeah, yeah. Now, some people are saying, will the dry eyes that's worsened during this time of life, will it continue being as bad? Will it get worse or will it get better? Or is that impossible to say?
For the majority of us, I would say this too will end. Much like puberty finally ends at age 30 when you become more emotionally stable. It will end for the most. So on our website on THK, we have a validated scoring system. It's another acronym, OSCI, I think. It's so terrible. But it's online.
Because I found it earlier.
Yeah, it's the online site test that's actually used in clinical trial. And you can look at the number. It gives you ocular surface disease index, it's called. And it takes 2 minutes to do, but it gives you a score from 0 to 100. So you can monitor yourself every couple of weeks.
Yep.
We think that once you start taking good care of your eyes with the oral supplementations or moisturizing the eyes, within 2 or 3 weeks, you should feel some difference in how well you feel. It doesn't take days. It's not a miracle drop.
Yeah.
Don't put one drop in and you feel great. It takes a couple of weeks.
Yeah. Okay, now I think that will be really reassuring for lots of women to hear. Actually, also on your website, I noticed there's quite a useful sort of almost like a symptom checker. So you can plug in your symptoms and then you can, work out which products are most helpful, which I thought, and it's very quick. It's quite easy, I think. And I think it would save people a lot of time from, going to see ophthalmologists themselves. It's kind of like a first line intervention almost.
Yeah, there's also a Q&A question. You can send in questions in there. So we have an excellent lady that runs our website. So she will feed these questions back to myself and my other colleagues. So we do respond. I don't give medical advice, but I know when I hear alarms, and I will send them to an eye doctor. But we do get those questions. And so if they have little things, please do feedback to us.
Okay. Somebody's just asked, can they get your products in Canada? Are they worldwide or is it only in the UK at the moment?
I'm not the business guy, but I think it's UK only at the moment.
Okay.
Yeah.
All right. Well, we'll work on that.
I'm the science geek, sorry.
Yeah. Okay. Fair enough. I'm sure somebody on the website can help.
Yeah.
A couple of questions.
I just got a text. Colleague, it is worldwide. I knew I would say something wrong.
Brilliant. Okay, well that's good to know. Now, a couple of more questions because I know you're super busy, and we said that this would only take half an hour, but there's just so many. Are short white flashes, somebody's asking, in the eyeball, are they anything to worry about?
If they're not persistent, no. These flashes come from the cells in your eyes firing off, so things being stimulated. And that's when you have jelly within the eye that tugs on the retina. If it's persistent and you have a shadow of a flurry of the new floaters, something not right in the corner of your vision, go see somebody. Because it could be that as it tugged, it tore the retina. But the odd little flash here and there, don't worry about it.
Okay, good. And there was another question. Somebody, now she actually sent me some photos. She had severely, almost like she'd had a kind of, it's an allergic reaction, really, really swollen upper eyelids. Why, and lots of people were talking about kind of, more allergy type symptoms. Why is that? I mean, I'm assuming you're going to say it's estrogen or, you know, sex hormone related, but is there anything that we can do to kind of prevent those constant triggers?
So it depends. That's a very big question. So I'm going to pretend it's really mild and not an infection or
it comes and goes.
Yeah. So it sounds like an allergy. Could be a new cat in the house. Could be a contact allergy, new eye cream. Throw your eye makeup away if it's too old. Could be any of those things. Could be food related as well. So if you're allergic to certain foods, it can come up. When you lie down, your heart is at the same level as your face. So that's why you wake up with a puffy face. And then as you walk around, the water drains. Cold compress helps. Yeah, it's about where your heart is. So, but you can't sleep up, right? So just wake up.
I've tried.
Run around a little bit.
That's a good tip, actually. Just to clean or your makeup brushes, but also to throw away makeup that is over. I'm assuming 3 or 6 months old, right? If it's mascara.
Yeah, 6 months, definitely. I can go into talking about the mites that can live in your eyelids, if you like, but that's a whole 5-minute discussion.
Well, if
I'll write a blog on it. I do have time at my next meetings in 30 minutes, but it's a mite that mammals, the only mammal host is a human being, and it's called dermodex, and they live on our eyelid margin. It's a cylindrical mite. It's quite gross. It looks like something from Alien, and it has little tendrils that hug on the hairs of your eye.
Ew.
And what's really cool about these mites is they have no butt, so they don't poop. They eat your dead skin and some of your live ones, and then they regurgitate it, and that's the dandruff. You get it?
Oh, you're joking!
And there are 2 types. There's the one that hugs your hair, and the naughty little brother that goes into the oil glands, clogs it up, lives there, regurgitate lots of gross things into it. I love to write a blog about this book.
Yes, you must.
Appeals to all of And then people don't talk about it. They say, oh, you have nephritis, use this, use that, and then wash your eyelids, scrub your eyelids. But the only thing that really works, that has good evidence for, is not baby shampoo. It's not the very expensive multitude of wipes that you can buy. It's tea tree oil. But be careful with tea tree oil, because if it gets into your eye, that causes severe irritation. But there are some tea tree oil dilutions and wipes that you can get off the counter. But if it's so severe that you have dandruffy eyes, we've all seen, usually the grandfathers that have that
kind of on top of your eyelashes.
Yes, on the edge where the eyelash is connected to your lid.
And does everyone have these mites? My kids are going to love this, by the way.
So, my kids go, don't show me. There's something to South American as well. Very cute. By age 70, there's good evidence that everyone has an element of it. And most of us will have a little bit of this mite in our eyelashes that gives us that gritty kind of, cruddy eyelids. And they have a 3-week life cycle, so they keep reproducing for the period of 3 weeks. So if you do any treatment for your eyes, it's again not a one-off, because the babies will get born and regurgitate all over your eyes again.
God. Fascinating, but disgusting at the same time. I think everyone's going to be running off to get their tea tree wipes now.
Yeah.
And then my last question, this is a really quick one, because I've just read about this. You can tell me if there's any kind of evidence behind it, is using just like a warm kind of compress, like a cloth. Is that helpful in relieving dry eyes because of those glands that you were talking about that get blocked?
Yeah, it's helpful in softening the oils that clog the pores of your eyelids, which is connected to the eyelash. Remember we talked about the oil layer on the tears. So the warm compress actually helps to soften the oils, and so when you wash it after the warm compress, it will allow you to clean the oil, the excess oil layer.
Okay.
I would say with the warm compress, there's a multitude of them you can get over the counter, but it will make your eyelids a bit puffy. We
right.
put cool cucumbers, So don't do it before you go to a dinner party. Do it in the night before.
Yeah. Okay. Brilliant. Amazing. So many tips. Thank you. And I would love, and I know my followers would love, a little blog post about those mites. I think it would go down. It would go down a storm.
I'll tell the team. I think the weird and the wonderful appeals. And I don't know about mass appeal. I've never been one that has mass appeal. So we'll see. Good to hear from you.
We would love it. Anyway, see, I know you're super busy. It has been fabulous talking to you. Thank you so much. I'll put all the information in the notes below with a link to your website and to the products. And I'm assuming if anybody has any questions about the products, they can go over to MTHK and they can ask questions over there.
Thanks so much, Emma. Lastly, the MTHK stands for Making Technology Humankind. And that's the choice of that was really in the world we live in now. Despite iPhones didn't exist when I was born. Actually, we didn't have emails when I went to university. You had to request for one.
Shocking.
Yeah. But yeah, the reason we did that is because it's all about wellness and eye wellness. So the technology really intertwines with that.
I love it. And I love the thing about your eyes deserve better. They absolutely do. So let's all make sure that we are looking after them as much as our skin and our hair. Thank you. Thank you so much.
Pleasure. I'll see you soon.
Enjoy the rest of your day.